Welcome to Airway Radio. This is episode 2 of The Beauty of Breathing. I am Dr. Martha Cortes.
And I am Dr. Jennifer Hobson.
This episode is going to be focused on Dr. Jennifer Hobson because she is a physical therapist. She applies the best practice into the most cutting edge. But it's not only that about her practice, she teaches. One of her biggest missions is to teach other professionals as well as to take care of her patients that need therapeutic approaches. So Dr. Hobson, how did you start with all this? I remember really when I first met you that we shared Dr. Rocabado. Can you tell me more about that?
Yes, I was a young therapist in Chicago working downtown, and I had come across Dr. Mariano Rocabado's basic craniofacial course. And I had found out that he was Chilean, and that happened to be like, wow, my mom's from Chile. We go to Chile every year. So I really wanted to meet him. Didn't know much about craniofacial. I was a young therapist. I was just interested in learning, and it opened the doors for so many things. So I'm very much known in the city of Chicago and Chicagoland for TMD, TMJ physical therapy. So pain in the face, pain with chewing, clicking, popping, lockjaw, that type of thing. And I've been training with Mariano every year in January in his clinic in Santiago, and it's really formed who I am. I understand. One thing that a lot of PTs don't understand is how the head and neck, the TMJ, connect to the rest of the body. And the upper cervical spine, how it twists and contorts when we lose airway health. And the airway health is something that not many people understand. What is airway health? And I know, Martha, you know exactly what I'm talking about, but the space between your airway and the diameter changes as we breathe improperly. And so I have a basis of knowledge from my training with Mariano Rocabado about how does the airway change as you breathe improperly? How does it affect your skeleton, your spine, your pelvis, your neck, your upper cervical spine, how it twists and it shifts your mandible? So TMD is a effect of poor breathing, but people come to me because of pain. You know, people have to have a reason to come and make an effort because everybody's so busy. So pain brings me patience. But since I've become, we'll talk about more about the breathing, but that's really how I started my airway quest of learning and understanding more. But I didn't know everything at that point. I still don't know everything now.
It's really interesting because for the International College of Craniomandibular Orthopedics, my thesis was you can't get the final bite. You cannot get the bite if your C1, C2 is off. You can't, because the sphincters are always the problem in what's going on with the bite. And you were one of the first persons that I understood, like, oh yeah, you can't get the bite if you have the neck wrong. And the torsioning, the smile makeovers that people would tilt their head to create the right smile because it was a cant in the maxilla, but it was really the mandible maxilla. But the guide was the upper, which is all your craniofacial things that you do.
Right. So
unique.
Yeah, the what a lot of dentists and physical therapists don't get is how the upper cervical spine, when you lose that space, say you lose, everybody has a forward head, they're looking at their phones, they're looking at their computer screens. We're not meant to sit so much, but we do. That loses what we call functional upper suboccipital space. That loss of space makes you twist up there, and then you have a tilt. How many people have tilts in their necks? You know, that neck tilt, a lot, right? So when your atlas, which kind of just sits under your cranium, has a tilt, it starts to shift. And that shift creates a higher side. And that mandible is right next to that transverse process of atlas, the first vertebra. So it will push that mandible forward and up. So you end up having a can't, and you have a harder hit on one side, and that creates a lot of compression forces through that one side, and it can cause over time degenerative changes and pain, eventually pain. So I get patients that want to get better and they do come because of pain, but I can't really stabilize them until I really address all the other things like tongue posture, breathing through their nose, that the swallowing pattern has to be there. Their volume of their breath needs to be there. So it's really, for me, I have to kind of educate them why they're having their problem of pain, but that there's a lot more behind that that's bringing into the situation. So yeah, it's been interesting, but so that's really what Mariano's brought a lot to my career, and I thank him so much for it all.
Well, you know, it's shocking. One, how the physical therapists, osteopaths who work with the whole body, but then they don't work with the neck because that's more like a specialty in physical therapy and osteopathy. Then you have the dentists that only work with the teeth, but don't work with the neck, don't work with the lumbar, don't work with the ankles because there's so much of the collapse in the arch. And when we met, when we first started speaking, that's why we were like, we spoke the same language and it wasn't really Spanish. It was the understanding on how it's truly all connected and the breathing. If they're not cycling correctly every 90 minutes, now their posture is going to go be affected. And you were one of the first to ever agree. And we'll talk about it first. You
Yeah.
have to get the breathing clinic, and you do that breathing clinic that several of my patients go to on because
Yeah.
you're worldwide Zoom on the breathing clinic. And
Yeah.
like,
The
why the nasal and the posture? Like, why the breathing? Like, tell me
Oh,
more.
okay. So breathing is what changes the posture of the head and neck. What I've learned through my training is that as you change everybody's stressed out, in my opinion. Like the pain patients that come in are very hyped up. They're go, 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 trying to fit all these, all the things that they do in their day. And there's not enough time. So they get uptight, revved up. They're in their heightened sympathetic nervous system mode, and they end up breathing fast, either through the chest with their mouth closed and the tongue low, or their mouth parts open, and it might not even look like mouth breathing, but it like this is mouth breathing, but you can't really tell. But they breathe faster, and their volume changes. When they start breathing up here, they use their accessory muscles, and their head starts to go forward. So their shoulders go up and their heads go forward, and they're using their scalenes to breathe, and they stay up. Not only that, their rib cage is up. So they are using all the wrong muscles to breathe, and it holds them in this pattern where their skeleton is out of cervical lordosis, which is the number one thing, for your neck.
Wait, what does that mean?
Cervical lordosis means you have a curve. You have three curves of your spine. The neck curve should be inward, like that, like a little bit of extension. The upper back should be kyphotic, a little bit rounded. The lower back should be again lordosis, so a slight extension. So when you lose that, and your rib cage goes forward, your head goes, or your rib cage goes up, your head goes forward. The cranial vertebral angle, the angle between your cranium and that second vertebra, is called the cranial vertebral angle. You need it to be a specific amount. If it's not that, you end up having a straight neck, and that over time overloads the joints improperly, and you end up with lower cervical degeneration. Like so many of my patients have C5, C6, C6, C7, worn out joints,
Yeah, and then there's
osteophytes,
fusion,
disc problems.
osteophytes, but fusion in the medical field is one of the answers. That I was supposed to get fusion in my first year and a half of practice. No, first year. So fusion, and then once you do the cervical C4, C5, then you got to do the lumbar C4,
Right.
lumbar L4 or 5.
And that's their answer. But really, if you learn how to breathe properly, your head starts to go back because what I train, the Hobson Institute is really my virtual program for training breathing, but it includes tongue training because many people don't realize their tongues are involved in the breathing apparatus. Your tongue needs to be up supporting the back of your throat. You need to be nose breathing so that you don't draw your neck muscles and chest muscles to breathe. If you breathe through your nose and you use your diaphragm, those two areas create the perfect volume and the correct mechanics. So your body stays calm and low and not up here and forward. So if you could maintain the curves of your spine using your body correctly, and that's really what I'm trying to do to all my patients is just restore normal physiology, normal use, normal breathing patterns, normal posture curves, normal sitting patterns, normal standing patterns, normal lifting patterns. I'm a functional physical therapist. So I am once you guide the body to proper mechanics and proper function, things resolve. You don't end up needing fusions. You end up using the proper alignment to support your body rather than fusions to hold your body up. So for me, I really truly believe that I think one of the things I really want to get everybody to understand is why they have pain. I educate every patient of their condition, what they're doing wrong, what they need to stop, how they should position their tongues and necks and spines, what exercises they need to do in terms of reducing the tension in their head and neck, reducing the amount of volume that they're breathing. So many people, Martha, are breathing heavy.
Oh, they're overbreathers. And then the overbreathing,
Heavy.
as you trained me, you were the first to really talk about this. I never understood it, where essentially the lumen decreases in the cardiovascular bed because the actual vessels get, I don't want to say thinner, but they contract. Talk
Tighter,
about that.
tighter.
Tighter. The
Yeah.
CO2, the overventilating and the CO2.
So many people don't get this. And this is like only
The
people
big
that
deal.
research it and understand it and want, that have severe symptoms of chronic fatigue, snoring, sleep apnea, that want other treatments other than CPAP and mandibular advancement devices. So many people are looking for answers, but the majority of people don't even know they have a problem, right? It's a hidden problem. But this over breathing pattern, so you end up breathing. I have patients, I put them on a little capnometer, this little machine that measures CO2 and breath rate. And it's been so helpful. I know I'm a Buteyko breathing instructor. Patrick McCowan is my mentor. He doesn't really use the capnometer, but for me, it's like to convince people they actually have a
Measurement.
problem.
The
It's
measurement.
just it's just an objective measurement. And I show them, I'm like, look at what you're doing. You're breathing 30 breaths per minute. We're really sitting here, not exercising. We really should be breathing about 10 breaths per minute. You're breathing 3 times as much. That's making you exhausted. And they look at me and they're like, oh my gosh, I didn't know that. Okay. And their CO2 levels, I want them at 40
100%.
millimeters of mercury. They're low. They're in the 20s. So what does that do? A lot of people don't know what that does. It ends up shrinking all the tubing in your body. CO2 is a vasodilator. It needs to be at a certain level, at that about 40 millimeters of mercury in your blood, in your body, to keep everything nice and open. When it's low, the smooth muscles around all your organs, even your intestines. Like a lot of people have IBS and they don't know why they have IBS. I was one of them. I'm a breathing patient myself. I used to mouth breathe. So I always had cold hands and feet. That's another symptom. And my gut was always like, just like, oh, I always felt like I had IBS. And then I became a breathing instructor because my kids ended up having tonsils and adenoids that needed to be taken out. And I was just so like, why are they swollen? We found out they were mouth breathing. We closed their mouths. We've trained their breathing. They didn't need surgery. And voila, their bodies are going back to a normal physiology. For me, I was a little late to the game. I was also tongue tied. They pulled my teeth at 12, my bicuspid. They pulled my third molars, my wisdom teeth at 18, 19, I think. So I was shrunk. My whole face was shrunk. And then I had a bent nose. I had a bent nose, and I was mouth breathing, heavy breathing, always cold, always tired, always sighing. So those are symptoms. So you're cold all the time, your hands and feet are cold, or your just body is cold. You're um, you're always congested. I was always stuffy, and I had a bent nose, and I didn't know it because it's hidden behind that face of yours. Then you have yawning and sighing all the time, and interrupted sleep, clenching. I had clenching. I have a tori on this left side because I was twisted. They didn't know I was twisted, and I was wearing down my left joint. So those are my symptoms, right? But it wasn't until I learned about myofunctional therapy. Okay, so my kids drove me into myofunctional therapy. And then all the myofunctional therapists take the Buteyko training, which you can't really train myofunctional without the breathing. You got to start with the breathing. Wouldn't you say, Martha? I mean, you
Right.
send me patients, and like if we don't start with closing their mouth and getting used to their nose, it's not going to work. Their mouth is always going to be and their tongue is going to be down.
But you gotta start with the breathing, and that's why I have the nasal rhino ma- manometer. Do you know how to say it?
Rhinometer. I think it's the nasal rhinometer.
And
Yes,
next episode, we're actually going to have Dr. Karen Davidson talk to
I'm
us
so
about it. I'm thrilled because it's really
yes.
breathing, 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 breathing. You know, like in real estate's location, location. Well, location, nose, 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 and it. My son, you and I were working together with my son, and my
Yeah.
son is the one who said, "Mom, you can't do myofunctional therapy without getting breathing therapy, breathing instruction." I didn't know I couldn't breathe correctly. I I was breathing through my nose, barely through the mouth, and it still wasn't correct. So he goes, "You have to have all your patients do Dr. Hobson's breathing clinic." I'm like, "Oh my word." From the
Yeah.
young comes the answer.
Isn't it interesting what their kids teach you? Well, because of the pandemic, I developed this whole program, and I have three different programs. It's either you want self help, you want to do it on your own, and I have all my online contact at the HobsonInstitute.com online for self help, and you
The
can meet with
videos.
me. They're all videos, but you can meet with me monthly in a group setting to ask questions, and everybody has access to my private Facebook page to answer questions. Then I have the Better Breathing program is more group related. So I run group breathing clinics that are all Zoom because you can do this on Zoom. You can with the pandemic. I realized you could. Then I have the one on
Yeah, I
which
really like those Zoom, but with the others online too, because
yeah,
it gave me a chance to practice. So I was
yes.
practicing what you were saying. We were going on to the others and reviewing the others personally on the clinic page. And I was like, oh, wow, it gave me a break. Had I been doing this all by myself, it would be a little bit exhausting. And I'm here I am a professional, accustomed to work and exercise. I said, I like how she splits it into a class.
Yeah. And I decided to create it's a year-long class now. It's a year-long program. All of the courses that I take are accessed within the year, and it's not rushed. Like I used to do it in a month, all the content in a month, and it was just really overwhelming. So I've broken it up so that patients have access to it for the whole year, and they can meet with me either monthly or weekly with the groups, or every week one on one. So that's the transformative program. So regardless, there's help for anybody in Spanish or English because I speak Spanish, and I do treat some patients in Chile and a couple patients in Spain right now.
Do
So
have a patient right now
yep,
who needed private. And the thing is, that private has done so much for this patient because he really should have had a lot of surgery in his nose. But the problem is, who cares about all the surgery if they're not breathing correctly? The mapping for the breathing wasn't there, the apparatus in the brain. So even they had all this, you know, septum, turbinates, the tonsils in the back as an adult, they don't know how to breathe. They were still mouth breathers. And that's what happens with all the surgery. They never learned how to.
Because it's neurological. It's not just mechanical. You have to train the brain to restore that nasal breathing pattern through the cranial nervous system. So you got to train the vagus nerve. You got to get the swallow down. You got to get these automatic functions that we do every day balanced out. And people that are heightened sympathetic nervous system, those cranial nerves are not working correctly. So that's really the Laney restorative breathing method that I incorporate in my breathing clinics. So yeah, it is once you're done with that and you are able to nose breathe, you're positioning your tongue correctly, you're swallowing gently and you're not straining to swallow, you're sitting upright, you're sleeping well. You know, everybody in my clinics, I teach them to use a dilator, to use the tape. Not all of them will do it, but I do urge them to try. And luckily, Patrick McCowan has created the myo tape that is not as scary to use, that you can put over your lips to kind of close your mouth so that your mouth isn't gaping open when you sleep. Because that will create what we were talking about before with over breathing, the heavy mouth breathing, that heavy volume creates a negative vacuum, which brings the walls of the airway in your nose and in your esophagus in. So those moments of apnea, those moments of snoring are from too big a volume going through your throat or your nose. So those walls, that's a nose snore. Not pleasant to hear for a spouse or a partner, but if you could learn to gently nose breathe and create the right volume and make that tube stay stable, not fluctuating and unstable, collapsing, you will get a good night's sleep and you'll be productive for your workday. So those are really the goals that I have for all my patients before I let them go. But it does take, Martha, it does take about a year to stabilize that. And people that want it like that, they're not going to get it. It takes that much time. I really believe that it does.
You're creating a whole mapping of the brain. See, this
That's
is
right.
because I tell myself, you're not exercising your nose. You're mapping your brain. You're not moving your tongue. I can move my tongue well. You're not moving your tongue. You're creating maps in the brain that you never had. You're making up for this man that we're talking about. 50 years of not, out of nowhere, has to create real maps, roads through mountains, has to cut out the mountain to create the roads because they never had the mapping in the brain. The
That's right.
homunculus system work, even the
Yep.
corpus callosum with the right to the left. There's and the crossing over just wasn't there. I'm amazed now at humans how much they are able to adapt.
Yeah. It's
Truly,
so true. It's so true. You know,
well, they
and
life. Yeah, go
yeah.
ahead. No, go.
No, I see all kinds of patients and a lot of them, I'm cranial facial. My in-person clinic is called the Physio Partners Renaissance Cranial Facial Group.
Yeah, and it says
And
asthma, I was going attention deficit disorder, anxiety, chronic fatigue. Okay, the tongue thrusts, the tongue ties because you prepare them for the releases. But then you go on into like lisping, sleep
yeah,
apnea, and of course the improper swallow and then improper breathing. But oh my word.
so it's a ton of different things. And babies to adults. I see the babies when they can't latch and they can't nurse, and we do cranial work on them. We do intraoral release. We teach the parents how to do it. We unwind those babies. We see patients with tinnitus. Like people are getting tinnitus, ringing in the ear, and that people start getting so panicked, and they even commit
Makes
suicide.
it makes them crazy, like
It
really
makes
crazy. I treat tinnitus also. It makes them crazy, and some of them been on amitriptyline, an antidepressant, low dose, anticonvulsant. There's even some patients that were put on a miniature chemo. And the thing is, that's a medical solution, but the truth is, it's a TMD symptom. It is the lateral torsion off on the left side. It is lateral torsion of the mandible upward with all this posture, but then the
Right?
second one is twisted down on the right, laterally torsioning up on the left. The C2 follows, C4, C6 follows. Then they get the forward head posture, the bump on the C6, C7.
Oh,
What's it called?
the dowager's hump. Yep.
Your hump. They're looking at the hump. Meantime, I'm looking at all the other things going on. And then the torsion, and then you find out they're not breathing really well because they don't have the correct nasal cycling. Then I'm thinking, oh my God, they're going to have a future hip replacement because that's where it starts.
Because their hip is
Really?
higher on one side and they're loading one side more, and that same side that's higher, they're hitting harder on that side of their mandible. And so those are the worst myofunctional disordered patients. They're all low tongue clenched. So
Oh,
what happens when you're low
wait,
tongue
wait. What
clenched?
is low tongue clench? Because
Okay, so low tongue, like everybody knows what clenching is, and they're upset and they're grinding and they're just like that. So imagine that you're canted because your atlas and your first vertebra, second vertebra, C2 are off and they're rotated. And when you rotate and you get higher on one side. So that side that you're higher, you're loading, and your ear is right. Here's my mandible, my condyle is about less than an inch in front of um my meatus of the ear, the little ear hole.
middle ear.
Yeah. So if you're clenching and you're hitting harder on one side, you're going to be compressing that whole side of the ear. I have a wonderful ENT. So I see a lot of ENT referrals from Northwestern downtown. That this Dr. Akira Matsuoka, he came to see my clinic and he spent the day with me. And he said, I know what you do. I know my patients need you and your team because tinnitus, when it doesn't kind of like the inner ear, that they've checked the ear, there's nothing wrong, and they've lost hearing, but
Yeah, hearing loss.
what do you do?
50% syllables. They can't go to a restaurant because they can't hear because of all the background noise. So they were. I have a patient that was planning to roam the world, and then she walks in and she can't really. She had that funny sound, the hearing loss sound,
Yes, yeah,
the
yeah,
hollowness.
yeah, yeah.
Well, we're happy to say that in 9 months her hearing loss returned.
Oh my
And
goodness.
the tinnitus, we took and I told her, I'm going to decrease your tinnitus about 50, 60%, your hearing loss 50% by 9 to 12 months. After that, it depends on your system. You're going to need some postural stuff. We got to test you for sleep disorder breathing to make sure it's not necessarily.
Right.
Story short, she now speaks almost whispers.
Oh my goodness. Oh my goodness.
She cried the first time because the tinnitus, the torsion in that C1
Yeah.
occipital space was so reduced. And the mandible on the left side, often left side, 80%, was so shortened by the clenching and the grinding that left it, that it shortened the left side more than the right side.
Yeah. Yeah.
And you were beginning to see the lip moving to the left.
Yeah. Yeah. So
All the
I work with a lot of dentists, including Martha, in at least in Chicago. What I do for these patients, I balance them, right? I just get them their curves back, their cervical curves, to get their upper cervical spacing nice and normal. Their atlas are even, their jaw is hanging, their tongue is up, their nose is breathing. But guess what? Mechanically, how old they are, if their airway's compromised, right? They need myofunctional therapy for sure to open up their airway, to create that space and support with the back of their tongue, supporting the back of their airway so it doesn't collapse back there. But if the condyles are worn down because there's been so much cleansing for so long and their vertical has been lost, they need dentistry. And they need a dentist that understands the airway and why it occurs. But we normally refer to dentists to create vertical, or the space that they've lost from the clenching over years. And a lot of times bringing their jaw forward away from their airway, because these tend to be airway patients. I don't know if you realize that in your practice too. Their airway tinnitus is like a symptom of what they've done for so long that they started getting this ringing. But with dentistry, you can really stabilize them, right? Stabilize them, either restoring with what you do, or devices that help open up, depending on, but sometimes money is a factor and you want to create that openness, at least for nighttime sleep. But that appliance with what I do in the breathing training, it makes their life come back to normal.
And in addition to the cervical exercise, airway, nose breathing, and it sounds like a lot, but you go sequence it. They have to have the lumbar correct with their cervical correct, and then they need to open up the vertical. Whether you put, some dentists will put a TMD vertical plastic appliance, but most patients don't want to live with that because that's what they're going to live with for maybe a year, and then they're going to have it during the night. Some patients, what you do is you do functional devices, more like orthopedic devices that you lift the lower. You literally unravel the lower, expand the upper a little bit, and what happens as a result, the lower jaw comes forward and you've opened up the vertical and wide, and it doesn't have to be a lot. And you don't have to be obligated to do a full mouth reconstruction. Although some teeth are very straight, you may have to do a few. But it's, you gotta start breathing.
Yeah, yeah.
And then the
You got to.
portioning that you do with Rocabado, the constrictors have to be released because they're so tight. No
Right.
one does the constrictors. Like
No,
that is like new.
the
Not
middle,
new, but
the
that is
superior, middle, and inferior constrictors, you release them so that they're not compressing the airway, really.
that goes back to Rocabada, where we
Yep.
started this.
Yes. Yes. And I'm just so grateful because I'm in a profession that you keep learning, and there's more to learn, and I always, when I learn more, I'm like, oh my gosh, I don't know that much, but then I realize, okay, this is a process. I'm connecting the dots. I'm connecting the dots with dentistry and PT, ENT and PT, orthodontics, airway, sleep physicians. All of it's confusing to people because not
How do
everybody
you
gets it.
sequence? How do you sequence? And what makes you more special is you share it, you teach it.
That's
That's
right.
a bigger deal. You have to teach it. You can't just get the answers for your patients. You share it by teaching. You run
Yeah.
programs. You
Yep.
run the breathing programs, but you also run programs with professionals. Can you tell us more and we'll close?
Yeah. So because this is kind of a newer field, I would say in the past 10 years, it's really developed more, but the physicians, the medical physicians, for example, Dr. Ravi is this big doctor at Northwestern that's more in alternative, but integrative. She wants me to teach her whole staff how to breathe properly. And we've done webinars together for her whole team, but nobody gets this stuff and nobody understands the tongue and nobody understands how TMJ works, and how over breathing works. So I educate it can be dentists, it can be physicians, any type of healthcare provider that is interested. I give courses through the Hobson Institute,
And
and I
not any, because not any will seek you. Not any,
no
because they have
open minded.
a little open eyes with the open mind to even get the idea like, oh, I had no idea was that connected.
Curious people that are curious, and it's once they own the ones that have the problem, that then they kind of start working with our teams and realize, oh my gosh, this is what's possible. It is possible to restore normal physiology in people. It is.
And more
If
towards
you have.
cure, cure and prevention. Because
Yeah.
there's many people that do treatment. I'm sorry, there's so many techniques. But is it towards cure? Is it towards cure and prevention? Now they're going to have to sustain prevention in order to maintain the cure. Because it's towards cure, which is very different.
Absolutely. And then that's really why I love treating children, the little babies and the toddlers and the young adolescents that are still growing, that's when you want to really get them. A lot of people think, oh, they're kids, they don't need, training. It's like, no, that's when you want to develop the right patterning in your brain of how to sit and how to breathe and how to swallow and how to, for me, I love my field. I love the collaboration with you, with all the different healthcare airway centric providers, because this is like, we're changing really the lives of these people and making their lives so much better, and their spouses and their families, because once you change one life, you're affecting everybody else in their life.
Mhm.
So thank you so much, Martha. Thank you for interviewing me. And I hope we're going to get a chance to obviously interview you in the next couple of podcasts as well, because I want to hear all about what you do for airways as a dentist. You are such a master in that field. And I'm looking forward to that too.
Well, thank you. And I am so grateful and so happy to have interviewed you because you are all about the beauty of breathing.
Breathing.
Name of our podcast, The Beauty of Breathing. There really is nothing like it.
That's right. Listen to the next one. And thank you so much.
Thank you. Good night. Good day. Good wonderful day.